What if every employee on every shift had a voice?
What if every single employee,
no matter where they work,
always did the right thing?
The kindest thing.
the best thing,
and don't forget, the safest thing.
With every patient.
Every time.
No matter what.
But I have a question. How do we get there?
Wait, I know. We'll get there together.
The Hospital of Central Connecticut, attaining new heights in excellence together.
2011 was an incredible year. It began when the Federal Trade Commission approved the affiliation between Hartford Healthcare and the Hospital of Central Connecticut's parent company, the Central Connecticut Health Alliance, uniting the Hospital of Central Connecticut with other Hartford Healthcare partners through a new look and logo shows people that we share common values and are working towards a common vision of excellence. Together, we're sharing best practices and cutting costs by working together in areas such as information technology.
We're working as one team to meet the information technology needs and challenges of the future.
We're cutting costs by purchasing things together.
We've already saved $1.6 million.
And in our pharmacies,
we expect to save $500,000 in pharmaceutical costs in fiscal year 12.
And in our laboratories,
we originally thought we'd save $250,000 per year on lab tests. But now, it looks like we'll nearly double that number based on our relationship with Clinical Laboratory Partners, another Hartford Healthcare member.
But working together has benefits beyond costs. We recently increased the number of rehabilitation therapists on our hospital staff while working with our Hartford Healthcare partner, Eastern Rehabilitation Network.
This also increases access to physical, occupational, and other therapies for people with Medicaid, as they can now be seen at our hospital-based and satellite locations.
At the Hospital of Central Connecticut, we recently launched H3W, which stands for How Hartford Healthcare Works. Every employee will be part of a work group. Those closest to the workflow address issues that will make the hospital a better place, improving quality overall.
Giving our employees a strong voice in what we do is critical to our success, but nothing could be more important than making sure we always provide our patients with the best and safest care.
That's why the hospital recently launched an initiative to increase safety by becoming a high reliability organization. We're integrating that process into our H3W work groups.
In order to accomplish this, we've engaged healthcare performance improvement, consultant experts from the nuclear power and military aviation industry. These are other industries, like healthcare, where the risk of failure is potentially catastrophic. Healthcare performance improvement has worked with over 300 hospitals nationwide since 2001 to achieve upwards of 70 to 90% reduction in the incidence of serious safety events that are preventable. We hope to achieve that here as well.
We believe these initiatives, coupled together, will prove to be the most important work the hospital has ever undertaken. Employees will work in sync and in tandem to achieve our vision of excellence.
Our journey towards increased excellence also includes bringing patients the advanced technology they need, like robotic surgery, as well as providing them with the services they need. This includes increased access to primary care. We recently rebranded and expanded our primary care practices. The Doctors of Central Connecticut has hired new physicians and opened new offices in Unionville to meet a growing demand. And we recently opened a satellite sleep center in Southington. The hospital also recruited many new physician specialists to meet community needs and filled key administrative positions. Connecting people with our doctors continues to be a goal. We participate with other Hartford Healthcare partners on 1-800-DOCTORS, a referral service, and look for ways to connect with patients face-to-face. Nearly 800 people have taken part in our Walk with a Doc program, where physicians lead a community walk and talk about a health topic. In addition, hundreds more attended our Health Wisdom lecture series.
Welcome to Healthy Rounds, the show that provides you with up-to-date medical information, and we're going to answer all of your health questions. I'm your host, Dr. Anthony Alessi.
Hospital specialists frequently appear on WTIC AM radio's Healthy Rounds with Dr. Anthony Alessi. Effective, timely communications remain a focus. The Hospital of Central Connecticut was first in the state to offer a service that allows people to text from their cell phones to learn emergency room wait times. And our Facebook page provides information about events, programs, services, even weather cancellations. In addition to helping our patients and community get healthy, the hospital is also committed to healthy employees. This year, we launched a multifaceted program known as Wait No More, designed to help employees achieve a healthy lifestyle. It included a Biggest Winner contest. The team of 4 that lost the highest percentage of body weight, as well as the individual with the highest total, won weekends at a health spa. Other prizes included Kindles, iPod Nanos, and jackets. How'd we do?
Together, we lost more than a ton of weight.
And just as the hospital supports its patients and employees, there are many who graciously support the hospital. The Connecticut Breast Health Initiative awarded the hospital a grant for a program on stress, nutrition, and fitness for breast cancer survivors. Another grant came from the American Savings Foundation for our medical legal partnership, which assists poor and at-risk children. We also received a grant from the Hohlfelder Foundation, founded by the late Fred Hohlfelder. Through his foundation and personally, Fred donated more than $250,000 to support our breast cancer initiatives, all in memory of his wife Charlotte. And we continue to rely on our community for philanthropic support. This year, the auxiliaries at our New Britain General and Bradley Memorial campuses raised $229,000 for the hospital through events including a golf tournament, fashion show, and our annual Chrysanthemum Ball. And the New Britain Auxiliary made an initial pledge of $1 million towards the new cancer center we're planning. Special honors at the ball went to Joy and Angelo Tommaso, who have supported our hospital for more than 40 years. Hundreds of volunteers were honored this year for their much appreciated service. At the New Britain campus, volunteers donated 50,186 hours, and Bradley Memorial volunteers contributed 18,459 hours, the equivalent of 33 full-time employees. There was other recognition as well. Our bariatric center has earned dual national accreditations. Our Jocelyn Diabetes Center was recognized by the American Diabetes Association for its self-management program. The hospital's Patient Safety Award this year went to Christine Prophet, a nurse in ambulatory surgery. And the hospital's highest nursing honor went to Nancy Marrow, a nurse who has worked here 35 years. And at our annual Employee Recognition Awards reception, 196 employees received awards for achieving service milestones, including Teresa Goffred, RN, who was recognized for 50 years of service. Social worker Eunice Wynn was named a healthcare hero by the Connecticut Hospital Association. Wynn also received the hospital's Excellence in Customer Service Award. Physician Anthony Chardella was recipient of the hospital's first annual William A. Pettit Jr. MD Physician Service Award for his extraordinary commitment to the hospital, patients, and community. Our Corporate Communications Department was recognized by the New England Society for Healthcare Communications with 7 Lamplighter Awards for Excellence. Director Helene Lightstone was honored by the group with its annual Lifetime Achievement Award. Social worker Aurora Jakubowski was recognized with the Above and Beyond Award from the Mill Foundation for Kids. Special events this year included our Healthy Family Fun Fest, which brought information about hospital services to more than 2,000 people during the day-long event at the AquaTurf. And our Moms program, Mothers Offering Mothers Support, celebrated its 25th anniversary of helping new mothers and was recognized by the Connecticut General Assembly. Nearly 750 cancer survivors came together at our 19th annual Survivors Breakfast, sponsored by our George Bray Cancer Center.
It was an exciting year at the Hospital of Central Connecticut. We look forward to 2012 and our new initiatives, technology, programs, and services. Our exceptional employees, medical staff, and volunteers will continue to work together in keeping with our values of integrity,
Doing the right thing.
caring,
Doing the kind thing.
excellence,
Doing the best thing.
and safety.
Doing the safest thing.
Every time.
With every patient.
And we'll accomplish this all together.
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 Together.